Welcome to Dentistionary. I guess now you guys are used to this subject and I hope you are enjoying this too. Students, if you have any doubts regarding any topic, kindly comment us. We will provide you the PPTs of this lecture in the description box. Okay, so today this will be our last lecture on the topic blood, and here we are going to describe you some important diseases related to blood. So let's begin. Firstly, what are the diseases related to blood? They include anemia, which is a condition in which blood does not have enough healthy red blood cells. It results from a lack of RBC or dysfunctional red blood cells in the body. This may lead to reduced oxygen flow to the tissues or the body organs. Means, in anemia, the red blood cells volume will be low, and this may lead to reduced oxygen flow to the organs required. Next, we have jaundice. It is the yellow discoloration of skin or the mucous membrane, as I have mentioned you in the topic hemoglobin. Next, we have purpura. These are the purple color spots or patches that occur on the skin and mucous membrane. It happens when the small blood vessels leak blood under your skin surface. Purpura, remember, is not a medical condition but a sign of another condition causing bleeding. Next disease we have hemophilia. I hope you know what is hemophilia. It is a medical condition in which the ability of the blood to clot is severely destroyed, means the blood does not clot so easily. This may cause the sufferer to bleed severely from even a slight injury, means a minor cut can lead you to bleed for longer period of time. This may lead to loss of blood. Next, we have leukemia. In this, the bone marrow and other blood forming organs produce increased number of immature or abnormal leukocytes. They suppress the production of normal blood cells. So these are some short description regarding all these diseases. In the next slides, we are going to describe it in brief. First, let us know what is anemia. Please remember, the topics like anemia and jaundice come in long note, so prepare it accordingly. So what are the types of anemia we have? Based on the clinical picture, anemia is of iron deficiency type, meganoblastic type, pernicious, hemorrhagic, hemolytic and aplastic. Next we have the normochromic normocytic anemia. What are these? They include the anemias of chronic disease, hemolytic anemia, which are being characterized by accelerated destruction of RBCs. As I said you, anemia means destruction of red blood cells. So when this is being characterized by excessive destruction, this leads to hemolytic anemia. It includes anemia of acute hemorrhage as well as the aplastic anemia, which is being characterized by the disappearance of RBC precursors from the bone marrow. Next we have the hypochromic microcytic anemia, where includes the iron deficiency anemia, thalassemia and the anemia of chronic diseases. And lastly we have the normochromic macrocytic anemia, which includes vitamin B12 deficiency and folate deficiency. Next, what are the symptoms in anemia? Some common symptoms are mentioned here. They are fatigueness, loss of energy, rapid heartbeat, shortness of breath, headache, and difficulty in concentrating. Other symptoms are mentioned here, you can look into it, like the dizziness, pale skin, leg cramps, and insomnia. Let us know what are what are the characteristics when anemia is caused by iron deficiency. People with an iron deficiency anemia may experience these symptoms. What are they? They are hunger for strange substances such as paper, ice, or dirt, upward curvature of the nails, referred to as koilonychias, soreness of the mouth with cracks at the corner. Anemia caused by vitamin B12 deficiency. What are the symptoms? They have lost sensation of touch, clumsiness and stiffness of the arms and legs, etc. Here there is a summary of the symptoms occurs during anemia, like yellowing of skin, yellowing of eyes, paleness of skin, shortness of breath, as I've mentioned, and other symptoms. Next, what are the treatment including during anemia? Anemia will correct within 2 to 4 months if appropriate iron dosages are administered and underlying cause of iron deficiency is corrected. Continue iron therapy an additional 4 to 6 months after the hemoglobin normalizes to replenish the iron stores. When you write the long note on anemia, please try to mention the following topics. They are the introduction, classification, types, their symptoms, and finally their treatment. Hope you have understood anemia. Next comes to jaundice. What is jaundice? It is a yellow discoloration of skin, eyes, and other mucous membrane caused by the presence of excessive accumulation of bilirubin in the plasma and tissue fluid. If the bilirubin level rises above 2 mg per deciliter, it leads to jaundice. I have already mentioned about jaundice in short in our previous lecture. Next, we have the synthesis of hemoglobin, or I would say the fate of bilirubin, where we have the RBC destruction, which is being circulated albumin bounded bilirubin to form unconjugated bilirubin, entering into liver, converting into conjugated bilirubin, which is being circulated into the kidney, forming urine bilirubin or urine urobilinogen, converting into fecal stercobilinogen, and finally into stercobilin. This chart is very important, guys. Next, we have the types of jaundice. In question, you may be asked the differences between prehepatic jaundice and posthepatic jaundice, or prehepatic and hepatic jaundice as well. So, this chart is very important. Next disease in our list is purpura. As I already said, these are the purple color spots or the patches that occur on the skin and the mucous membrane, and it occurs when the small blood vessels leak blood under your skin surface. What is written here? These are the clinical condition in which the capillary abnormality results in bleeding. This is known as purpura. It is being characterized by spontaneous hemorrhages beneath the skin, mucous membrane, and in internal organs. Next, we have leukemia. What is leukemia? Leukemia is cancer of blood forming tissues, including bone marrow, hindering the body's ability to fight infections. Different types of leukemia include acute lymphoblastic leukemia, acute myeloid leukemia, and chronic lymphocytic leukemia. There are certain symptoms which are found in leukemic patients like chronic fatigueness, swelling of lymph nodes, shortness of breath, swelling of liver and spleen, muscle ache, and they are found certain tiny red spots beneath the skin. Thank you so much, guys. This is the end of the unit blood. In our next lecture, we'll try to complete our NMJ topic, that is the neuromuscular physiology. We'll provide you the lectures and certain important topics related to them. Hope so you are enjoying this journey in Dentistionary. Keep supporting us and keep sharing this channel. Thank you.